Hello everybody, this is Henning Eckstein from Munich in Germany. Before I start, I want to thank Professor Nico Nanko for inviting me again and for organizing another fantastic meeting. It is my pleasure to talk about local anesthesia for carotid endarterectomy. Within the next minutes, I will discuss with you the latest Cochrane review on RCTs comparing local with general anesthesia, some data from registries and systematic reviews, and some very preliminary own data. Finally, I will give you some key arguments for local anesthesia for CEA. This is the Cochrane review from 2013, including 14 randomized controlled trials. The result was that the stroke and death rates at 30 days were 3.6% after local anesthesia and 4.2% after general anesthesia. This difference was, of course, statistically not significant. So is local anesthesia really safer for carotid endarterectomy? Well, let's have a look at registries, further prospective trials, and systematic reviews. We then had the opportunity to have a closer look to the German carotid data bank, including more than 140,000 patients. In 27% of those patients, local or local regional anesthesia was used, and the rates of any hospital stroke or death was on average 1.8%. The multivariable analyses of these data revealed that intraoperative completion studies and antiplatelet therapy perioperatively were associated with better outcomes. Most importantly for this talk, we also detected that the use of local anesthesia as compared to general anesthesia was associated with a relative risk reduction of 16%. This is an analysis of the carotid stenosis trialist collaboration on symptomatic patients only, published last year in Stroke. The main finding was that the rates of any stroke or death within 30 days is lower now as compared to the old data from ECST and NASET. Another finding was that local anesthesia was statistically independently associated with a 30% relative risk reduction. Very interestingly, the main findings of the German Carotid Data Bank and the CSTC data were confirmed by a very recent review article on actually a systematic review on general anesthesia versus local anesthesia and CEA, published in the Journal of Cardiothoracic and Vascular Anesthesia. Based on 31 studies with more than 150,000 surgeries, local anesthesia was associated with lower rates of in-hospital stroke, cardiac complications, or mortality. Finally, some data from my own institution. As you can see, we used local anesthesia more and more over the years. In parallel, the in-hospital stroke or death rates decreased also over the years. Statistically, by use of a univariate analysis, local anesthesia was associated with a significant decline of major stroke or death over time, with an odds ratio of 0.22. So what are the key arguments for local anesthesia for carotid endarterectomy? Most importantly, of course, the awake patients. As you know, roughly 50% of all perioperative strokes occur very early or even intraoperatively. Under local anesthesia, any neurological deficit can be detected very early and treated properly, either by reopening, shunting, or whatsoever. This leads to lower stroke and death rates, and in conclusion, I would dare to say that we have more and more evidence that local anesthesia is safer for CEA than general anesthesia. Ladies and gentlemen, thank you for your attention. I would be more than happy to welcome you in person at the 10th Munich Vascular Conference in December this year in Munich. Please stay safe and healthy.